Hi everyone, I'm Dr. Dan Williams and I'm an osteopathic physician based in Carmel, Indiana. Typically, I work with patients with pain and complex health conditions who want to try to maximize their health and help their body help itself as naturally as they can. During this COVID-19 outbreak, I've been receiving a lot of requests and questions from people around the world about things they can do to help themselves and their loved ones boost their immune system and also look for natural solutions for various antiviral products that seem to have some sort of research about how they can help in other viral infections and possibly help protect them against COVID-19. And I think you're going to find that there's certainly a fair number of substances out there that have some research support that shows that they do help in various viral infections and that may be beneficial against COVID-19. Of course, COVID-19 is a emerging viral outbreak. We don't know a lot about it, and that includes both conventional modern medicine, but also in terms of integrative things that we can do. It is new, it's novel, we don't know a lot about it, but if you are looking for some strategies, especially natural strategies, you're going to find this presentation informative. And so what I'd like to start with is talking about really one of the fundamentals about how you can protect your family, and that is by working on your diet and nutrition. Dr. Joel Fuhrman has established a practice that focuses on really using food as medicine. And he has published several books. They're all excellent. And in his book, Super Immunity, he talks specifically about foods that tend to have properties that tend to help increase the parts of our body that are immune defenses, that tend to help our white blood cells and other processes that help us whenever we have either bacterial or viral infection. Some of the simplest recommendations for that are to increase your intake of fruits and vegetables, which luckily, at least here in Indiana, when I go to the grocery store, we're out of ice cream, we're out of toilet paper, but you know what? The produce section is well stocked. So increasing that intake of fruits and vegetables, an easy thing to remember is try to eat the rainbow. Lots of different colors, lots of variety. But also decrease our intake of dairy, gluten, and sugar. In terms of the top foods that we know seem to help the immune system, here's a list. You can see that certainly we have a lot of greens that are on here. Kale, cabbage, broccoli, Brussels sprouts are definitely key components to have in the diet during this time. Onions, leeks, garlic, berries, lots of antioxidants, as well as seeds. So these can all be good options and have some evidence behind them that they can help fortify the immune system and help you recover from infections quickly. Now, if you become ill and your diet isn't optimized, then things like vitamin C can be beneficial. Ideally, we'd be getting enough vitamin C from the diet, but unfortunately, there's a lot of people around the world, even here in America, that don't get sufficient vitamin C or zinc. There is some evidence to suggest that elderberry, as well as other berries, can be beneficial during both bacterial and viral infections. Caloric restriction, eating a little bit less, can be helpful. And then, of course, minimizing the dairy, the gluten, the sugar, and other processed foods. One thing I forgot to mention a little bit earlier is that it's, of course, important that if you're making drastic changes to your diet or changing your supplements, you want to make sure that you consult with your doctor. I think having that doctor that you can talk to that respects the things that you're trying to do for your health and partners with you is key, especially during this time. And before you make drastic changes, it's always a good idea to check in with them. As we get further in the presentation, we'll be talking about supplements and herbs, some of which are available over the counter. But again, it's always a good idea to make sure you check with your doctor, make sure they're right for you. In terms of nutritional supplements, there actually is a fair amount of research out there about how, in particular, the substances on the screen can help your body fight against viral infections. And I'm going to go through several studies for each of these. And some of these you'll find are done on animals, which we do a lot of testing on vaccines and things like that in eggs or animals. And you're going to find some of that in the research. And so again, we don't have specific evidence for COVID-19, but what we do have for these products in particular is some evidence that suggests that they may help boost the immune system and or help fight viral infections with other viruses. N-acetylcysteine, or NAC, again, you're going to see a fair amount of research about this. Now, of course, this here's from a veterinary journal, and what we find here is that, this was done by the Department of Veterinary Pathology, but these, I believe the study here was still done on, what was done on animals, but they were trying to apply it back to humans. But what they found was that in patients with respiratory conditions with excess mucus, so you get an upper respiratory infection, you get that nasal congestion that certainly I get with upper respiratory infections. We know that N-acetylcysteine can help with that. We know it has antioxidant properties as well. It has also been shown to limit lung inflammation and viral growth. And of note, just like I've been saying, we don't have specific details about N-acetylcysteine for COVID-19, but depending upon the strain of influenza A, which was being tested here, they found the antiviral activity could be widely variable. And so again, we don't know about COVID-19, and this study suggests, again, there may be some benefit, but it does vary on the strain of the virus. Here's another study that again talks about how this can inhibit replication and the effects that it can have on virus-induced pro-inflammatory responses. And so down at the bottom here, what I highlighted for you is antioxidants like N-acetylcysteine could be a potential additional treatment option in the case of influenza A pandemic. So again, we don't have an influenza A outbreak, but again, we also don't have, but this may be an option if you're trying to protect yourself, your loved ones, from this coronavirus. Selenium is another supplement that seems to have some decent support in viral and bacterial infections. Most of us don't have a diet that is sufficient in selenium, in particular when we're sick. And what's very interesting was that this particular study, published in Advances in Nutrition, talked about how selenium may be useful to improve supportive care and strengthen the immune system of patients suffering from newly emerging viral diseases. And so I thought that was quite interesting. The research in particular here was looking for selenium to help with Ebola. But certainly, again, we are in an emerging viral epidemic or pandemic right now. And so, again, selenium may be another option if you are looking for natural things. Again, this is from a textbook where, again, they talked about how the deficiency in selenium can lead to increased viral pathogenesis. Zinc, another supplement that can be very beneficial in the case of viral infections. Zinc deficiency is pretty common, and zinc status can be quite critical if we're looking at trying to naturally fight viral infections. Again, the abstract from this particular study in Advances in Nutrition as well in 2019 talked about zinc deficient populations being most at risk of acquiring viral infections. And so again, even in their literature review for this particular article, an abundance of evidence has accumulated over the past 50 years to demonstrate the antiviral activity of zinc against a variety of viruses and via numerous mechanisms. And so again, zinc, another key supplement as you're navigating this coronavirus pandemic. Well, we also know about zinc for the common cold. There's various types of lozenges out for the common cold. This has been around for quite some time, and again, a fair amount published about it. Vitamin A has some interesting antiviral effects, and there's been research on vitamin A in several different areas of physiology. Some of it has been on the gut microbiome, which there's a lot of study going on about that. But then there's also some studies about how the vitamin A and the retinoids help in our antiviral response. And so, again, very interesting how vitamin A may be playing a role. This second study talks about how they may be playing a role in the epithelium. That's some of the lining that you might find like inside your nose, your mouth, your throat. And another interesting thing is how the vitamin A in this second study, how it may help prevent secondary bacterial infections. It's not uncommon when somebody gets a virus. One of the challenges to viruses is antibiotics don't work against viruses, but sometimes people with a virus get a secondary infection. So their body's kind of weakened by the virus, then a bacteria comes in. That's why sometimes people with viral infections end up getting placed on an antibiotic is for these secondary bacterial infections. And again, there seems to be some evidence that vitamin A may be leading to deficiency of vitamin A, may be making it easier for some patients to develop these secondary bacterial infections. There's been some research in using vitamin A for viral infections in children. As I mentioned earlier, again, before you start supplements, before you start radically changing your diet, it's always a good idea to speak with your doctor. And I did want to caution here, this study did not find a difference, a significant reduction in mortality. But what I want to point out, in case you do some of your own research on vitamin A, is that they are using very high doses of vitamin A. So in this particular study, 200,000 international units. And again, you would not want to be doing this without a physician's involvement in your care, because vitamin A is certainly a supplement that you could overdose on, and you wouldn't want to be taking a dose this high without a physician monitoring your care. So I did want to point that out, again, if you're doing your own research and you notice that particular number. But along with vitamin A, vitamin D seems to play a significant role in influenza. In fact, in this study, as they were talking about the role of vitamins A and D, they talked about how a deficiency of vitamin D has been suggested as a trigger for the influenza viral replication and is one of the components of the seasonal influenza, right? We start to get the flu, and if you've been listening to Dr. Fauci on the TV, he talks about how this coronavirus may start to come back again in the fall. In the winter. And he's talking about how now as we're coming into summer and we're expecting it to decline, but they're starting to see a rise in cases in the southern hemisphere, because now remember, they're starting to go into their fall. And so one of the things that happens during the fall is we start having less sunlight. So unless we're closer to the equator, we start getting, it's not uncommon for the population to get vitamin D deficiency. And so again, that has been postulated as potentially one contributing factor into how we see this seasonality with influenza. What's also interesting is that, again, as COVID-19 is around, as we learn more about it, there's been currently, as I'm recording this now, several different theories out about what are those coexisting conditions that put people at higher risk. What's interesting is that in this particular study, they found that those with liver disease, diabetes, and obesity worsen the severity of infection, possibly via the alterations in the vitamin A metabolism. And what's interesting is, at least right now, they are talking about how patients with obesity, diabetes, potentially liver disease, but also kidney disease, how they are at higher risk right now for dying from this coronavirus. So again, it's kind of interesting how we start seeing some similarities between some of these studies that aren't specific for coronavirus, but certainly some things that do seem to be lining up with what we currently know about COVID-19. So vitamin D, again, when we talk about its antiviral properties, we are seeing this researched in HIV. This is an ongoing study. And again, we want, this study here talks about how vitamin D may be helpful in enhancing first-line defense against invading microorganisms. And so again, vitamin D, a very good thing to supplement, but again, you can have too much of it, so it's a good idea to have a doctor check your vitamin D level. Again, just one more study about how vitamin D impacts the immune system. There's lots of research out there about vitamin D. And I particularly like this one that also mentions specifically vitamin D replacement, reducing the risk of acute respiratory infections in those individuals who are vitamin D deficient. And so, again, lots of evidence about vitamin D, so this is a good one to supplement. Melatonin, again, this also seems to play a role. And there's been a discussion about melatonin in bacterial and viral infections with sepsis, as well as some of its anti-influenza and antiviral effects. So melatonin is another good supplement. It'll help you make sure you get good sleep, but also may help with the infections. Near and dear to my heart is osteopathic manipulation. So when we think about the things that we can do, now we're transitioning from prevention. Those are things like diet. Those are things like supplements. And now we're starting to transition a little bit more into treatment options, but also still with prevention. Osteopathic manipulation is a gentle, hands-on manual medicine that an osteopathic physician uses their hands and helps encourage the body to work better. So by palpating the physiology of the patient, by gently using the bones, muscles, connective tissues, they're able to help the circulation of the blood, able to help the circulation of the lymphatic fluid, which helps with infections, help make sure the ribs and the rib cage are moving. This is especially important with COVID-19 because we've heard a lot about the pneumonia, the cough. We want to make sure that we're giving those patients every advantage to have excellent respiratory function so that they can expel that phlegm and breathe as easily as they can. If you've had a severe bronchitis before, or potentially pneumonia, or even bad allergies with severe coughing fits, you may notice you start to just your chest gets tight, it gets hard to breathe, and it's just hard to take a big breath. And osteopathic manipulation can often help with that by moving the ribs, making sure they have good motion, by making sure that everything is optimized. You can help give yourself and your loved ones every possible advantage, either in preventing this disease or in treating someone who has it. There's been a lot of research about osteopathic manipulation in the treatment of pneumonia, and I put some of those studies here. But really, this has been used for over 100 years in osteopathic medicine for the treatment of influenza, through the Spanish flu epidemic, and through other pandemics that have happened in the history of osteopathic medicine. So this is certainly something that you want to find an osteopathic physician in your area who uses this and who can help you and your loved ones should it become necessary. We want to think also about our mental health because, as you can tell if you're on Facebook or Instagram, everybody's on there right now, and hopefully we're all following our social distancing procedures. And unfortunately, this isolation isn't good for us. And additionally, we also know that stress is bad for our immune system. This has been around for a long time. They've done some wacky studies with medical students where they have, during final examinations, tested their immune systems, exposed them to viruses, like upper respiratory common colds, and noticed how much easier they can get sick during these stressful times. And so certainly with the economy the way it is, with our concern about our country, with a concern about our loved ones and what's happening, we want to manage that stress. At the same time, one of the ways we manage stress is with our friends, and we have to isolate. So some ideas. First, don't ruminate and turn off the news. We don't want to sit and just think about things over and over. We want to try to control that as best we can. Social isolation is hard. So if you're isolated, make sure you get some support without increasing risk. FaceTime, Facebook Messenger, or like we're seeing some of the videos in New York City, people talking across the alleyways through their windows. So make sure that you are still getting some social support during this time. And again, there's also the simple things like yoga, progressive muscle relaxation, guided imagery, meditation. Many of these have research that show that they can actually help boost the immune system. Just one simple study talked about guided imagery, and again, how it elevates all of these cells that we can track in the blood by doing that, by getting rid of some of that excitatory nervous system input. It allows our immune system to thrive and become more functional. So the mental health can be a key component to keeping you healthy during this national quarantine and during this national pandemic. Traditional East Asian medicine most people think of that as like acupuncture and potentially Chinese herbal medicine, has really been at the forefront of this outbreak. In China, there's various reports coming out that most patients in China with COVID-19 do have some combination of both modern medical treatment and traditional Chinese medicine, most often in the form of herbal medicine. And this was an interesting article here where they say that Beijing is pushing traditional Chinese medicine despite questions over its benefits. But what I thought was quite interesting is that they added there's no evidence of a downside. And I think this is one of the clearest things. So why stop using it at a time when any kind of treatment is much needed? But the article also goes on and talks about, again, some of the benefits that they are seeing with traditional Chinese medicine during this pandemic. There's a lot of YouTube videos also discussing this and how they're incorporating both traditional Chinese medicine as well as conventional medicine. I was able to get the YouTube link from this video where actually a Western critical care physician was talking about how he himself doesn't understand the traditional Chinese approach. But again, he has found benefit to his patients who have received this combined approach. They have also published, several universities in China have published what they've been doing in terms of herbal medicine to help prevent and also treat coronavirus patients. These studies have been out, and they, for those of us that have some exposure to using these herbal treatments, those articles have been translated and are being disseminated. There's several of them, and here is one from that came out rather recently about COVID-19, and talked about 3 studies using Chinese medicine for the prevention of SARS, 4 for H1N1, and none of the participants who took Chinese medicine contracted SARS. Now remember, SARS was a previous viral outbreak, and then for H1N1 influenza, when that was out, there was a lower outbreak then. And so again, while we are waiting to find out, and things are starting to come out, studies are starting to come out, and guidance on things that seem to have worked in China, there are researchers putting together studies that show how, again, for other viral outbreaks, these herbs have proved to be beneficial. In terms of acupuncture, there is a study from Japan that talks about how there was a positive effect, in this case, for the common cold, which is often a viral infection. And then this study, this is from Korea, in military service members, again, about upper respiratory tract infections, and then also another one from China about atypical pneumonias using, I believe this was using acupuncture as well. And so as we navigate this difficult time, it's scary, and we all want to do what we can to boost our immunity, to hopefully avoid getting this disease, but also to do everything we can to take every advantage we can to successfully beat this virus should we contract it. And so, of course, I recommend everybody follow the CDC recommendations, to follow those recommendations of your local government officials and public health experts. But in addition to those things, hopefully you have a primary care physician that you know and trust, and you can start to arm yourself with some of the things that you can do to help boost your immune system and the immune system of your loved ones. But of course, there's no way that I can diagnose you without meeting you and talking to you and working with you on this. If you would like to work with me, you can. My contact information is on the screen. But if you want to do your own research, again, I always encourage you to make sure that you speak to your own physician before you make radical nutritional changes, change supplements, and especially I definitely would not start buying Chinese herbs off the internet and trying to treat yourself. That's definitely something that you need someone trained in that to help you with. So I hope this helps you as we navigate this crisis together. I wish you luck, and again, if I can be of further service, please don't hesitate to send me an email from my website or give me a call. Thank you.